Let's talk a little bit about recovery. First, recovery immediately after the surgery, and then the long-term recovery. So let's talk about that first 2 weeks right after the surgery.
Yes, so the first 2 weeks after the surgery, as far as the diet is concerned, usually we put the patients on a full liquid diet, and then we slowly advance them from full liquid to pureed, and then regular diet. So we have them on a high protein, low carb diet. That's generally what we do.
And that's for how long?
And that's going to be for over a 6-week period.
6 weeks.
And then they go to a regular diet, high protein, low carb.
And how much less food do they eat just for their life?
So at the beginning, it's difficult because they're not taking a lot of calories, but if they don't reduce their caloric intake, they're not going to lose the weight. One of the bigger issues that we see, and one of the complaints that we see from the patients, is staying hydrated, because they're just not drinking enough liquid. And constipation, because if they don't drink enough liquid, you get constipated. So we tell them to carry water bottles along with them during the day and at work, and they're constantly sipping. Remember, these patients cannot gulp a glass of water anymore.
Okay.
So they have to drink small amounts, so very small amounts. And then the other thing that we see with the diet is, one of the things we tell them is when they eat their food on their plate, to separate from the liquids, because if they start to drink and eat at the same time, they're not going to get enough calories that they need during the day in nutrition, because they're drinking, they'll get too full and they won't take all their requirements.
What about alcohol intake?
Alcohol intake with the bypass can be a problem. You can drink, but a lot less.
Moderation.
Because the effects of the alcohol are more pronounced. With the band and with the sleeve, it's a lot less. But on the other hand, you have patients who are losing weight. When you lose a lot of weight and keep drinking the same you were before, it could be a problem because the effects are more pronounced.